Hello and welcome. I'm Andrew Richard Albanese, Senior Writer at Publishers Weekly, and I'm happy to welcome you all back for the first 2021 installment of Live from the Library Lounge webinar series. Today we're going to take stock of where libraries stand a year after the COVID-19 lockdowns began. And yeah, it's been a year. So we're going to talk a little bit about, what we're all still living through, what we've learned, what mistakes we may have made, what questions remain, and what the coming days, months, and even years hold for libraries in the wake of what has really been a historic public health crisis. Before we start our discussion today, I want to take a moment to thank our sponsor, Library Ideas. I'm sure you're all familiar with the work of Library Ideas, especially as library closures have necessitated more digital offerings. Among the Library Ideas products are the Freeding ebook service, Freegal Music, and you can check out the full range of the Library Ideas products at www.libraryideas.com. So please join me in thanking Library Ideas for making today's event possible and for their support of our nation's libraries. Thank you. Since I started planning for this discussion, which was actually back in late December of 2020, I've struggled with how to structure it. For one thing, a year later, the pandemic is in some ways worse. Deaths and new cases until 2 weeks ago were surging. And, as we approached year two of a crisis that at the outset, most of us thought would last maybe a few weeks, maybe a few months, it began to dawn on me that this second year of living with COVID-19 presented a whole new set of challenges for libraries and library leaders to navigate. But what's made this discussion most difficult for me to host is that I've not stepped foot in a library in a year. My children have not stepped foot in a library in a year, not even in their school library. And yes, here in New York City, they are fortunate enough to have a school library. Before the pandemic, it was inconceivable that I'd go more than 2 weeks without ever stepping foot in a library. And not as a reporter who covers the profession, but as a citizen who values what my local library here in New York City brings to my life. Since the 2020 ALA Midwinter meeting in Philadelphia, I can count the number of times on one hand that I've spoken to a librarian face-to-face. Now, I get a lot of email, and I talk with a lot of librarians on the phone, and there's a lot of Zoom, of course, but it's just not the same. So for today's discussion, I really wanted to hear directly from some library leaders around the country about what their experiences have been and what they expect the future to look like. And I also reached out to Columbia University professor Jeffrey Shaman, who's one of the nation's foremost researchers working to understand this novel coronavirus. And we'll have an excerpt of that interview for our discussion today. And the full interview, it's 32 minutes long, will be available on the PW site later. So, we're not going to solve all the library world's problems today, but my hope is that today's discussion can contribute to the necessary ongoing discussions that I know librarians around the country are already having every single day as we approach year two of a pandemic that has upended our lives. So with that, let's meet our panelists for the day. Joslyn Dixon. She has served as the director of the Newark Public Library since August of 2020. I hope I have that right, Joslyn. That's right. She took over Newark in the teeth of a pandemic. She was formerly the deputy director of the Prince William Public Library System in Virginia, and she's also served as the chair of the Virginia Library Association's Librarians of Color Forum and as VLA's vice president. Welcome, Joslyn.
Thank you.
Brian Kenney is the director of the White Plains, New York Public Library and a former editorial director of Library Journal, School Library Journal, and Publishers Weekly. He is also currently a Publishers Weekly columnist and contributing editor. And in June, he wrote a column called All by Ourselves that sort of addressed the systemic challenges and the lack of guidance that librarians battled through in addressing the pandemic. Brian, welcome.
Thank you.
Dr. Annie Norman is the state librarian and director of the Delaware Division of Libraries, a role she served in since 2002. Under her leadership, the statewide Delaware Library Catalog Consortium was established. Currently, 74 participating libraries are now sharing 2.5 million items for the benefit of Delawareans. In 2016, she was the first librarian to be inducted into the Hall of Fame of Delaware Women. Welcome, Annie. And Patty Wong. Patty is currently the city librarian for the Santa Monica, California Public Library, and she is the president-elect for the American Library Association. She will take office in June 2021. She's a Library Journal mover and shaker, a recipient of the ALA Equality Award in 2012. Thanks for being here. Welcome, Annie. or excuse me, Patty. So, to get us started, a lot has changed since the first days of the pandemic. And I have to say, here in New York City, those days were truly scary, right? We felt sort of besieged. So much was unknown. And yet my family had it pretty easy, right? We could work from home. We had that option. And I think many librarians experienced those days very differently. I think many will recall the job insecurity and the scramble for PPE, the personal protective equipment. People were turning socks into masks and making homemade sanitizer. And we had the president of the United States who was going on TV saying, hey, this is no big deal. So I'd like to sort of start by asking each of you to reflect on the early days of your pandemic and also tell us how you've managed so far and how your library has managed so far. Are you serving users with curbside service, digitally, Zoom book clubs, outdoor space, how you're managing? And, Joslyn, I'll start with you. You took over Newark in the middle of this pandemic, and you've also worked at other libraries during the pandemic. Give us a sense of your experience.
Oh, boy. Thank you for starting with me, and I'm glad to be here. Welcome, everyone. Yes, in Virginia, I actually worked at 2 libraries. I was the deputy director at Prince William Public, and I also had a little side hustle at Loudoun County Public Library. And just to touch upon some of the things that you said, it is so different. The response, it was even from county to county different. So one place I worked, it was besides like maybe the admin people and very high level people. So that was a side hustle, right? Because I was like a reference librarian. Like all the part-time people were home, no subs, no, nobody, everyone stayed home besides basically admin. And then the other librarian was, where I was deputy director, the response was much different. So it was, we were close to the public, but we all came in every day. And then if we didn't work, we also helped the county out. So we would people were doing things from filling hand sanitizer bottles to answering emergency lines, because everybody had questions. And what are we going to do? And what do we do? And how do you know? And where's the testing? So, so I came to Newark with those 2 experiences under my belt. And I definitely mentioned them when I was interviewing because it was a blessing, even though it was very hard, to have those 2 experiences under my belt so I could see the pros and cons of both. And then, like you said, I started in Newark in August when it was still going on. So I could walk in with some experience in going to totally closed. And then when I was coming, Loudoun County did reopen again, slowly reopen. And so they had a whole really good cleaning protocol in place and all those things. So I brought those things to Newark. So when I came to Newark, what I found in the very first day, and this was still early on, but then it was waning a little bit in August. But when I came, and not to go on and on, we had a curbside service going on. And I use the word curbside lightly. It wasn't curbside in a way of people pulling up with cars. We're in the city. There's not, often there's not a lot of places to park and pull up. You're on a busy street or whatever. So how we did it was essentially like in a Tupperware box, and people just kind of picked it up outside. And so needless to say, that did not go very well. The stats were really, really low on that. But then we also learned something from it. It told us a story. So it told us, like, how do our people use the library? And what are they using us for? They're using us for computers. They really love our programs. And just people leisurely checking out books to read. Kind of like Cloudwoods, Virginia, some places we had like 800 holds, just like teeming, like, surging, waiting to go out, and that wasn't the case here. I actually pulled out my stats just to kind of make that argument when we had some pushback about being open, and we were doing something like 19 checkouts for the month at some places, and so I couldn't sustain. So in August, that's when the numbers were going down, if you remember last year, and so I formed They already had a reopening committee. So we met with the reopening committee. We got a plan together about how we could open safely. So we just implemented it. It was probably about 7 or 8 pages long. So it included, opening, closing, and that was in September, how we would clean, how we would limit people. And so we're using that now in closing. And then what we do is we look at it in like every 2 months or so and keep tweaking, because to me, it's important not to I feel like sometimes locations, we get stuck in a reopening phase while it's because things change so fast. It's understandable also, but it's a never ending thing of watching the news, reading things, following the science, listening to what the CDC says. And so like even now we're thinking of, do we need to have closed stacks like at Maine? Do we need, because some places we still do that. So that's where we are now. So hopefully I didn't take too long to answer, but that is it in a nutshell. We're open now. We have had to close. We closed briefly for about 4 weeks back in December and November, but we have limited opening where we have people in the library.
Great. Thank you for that, Joslyn. Mm-hmm. Brian, you were sort of near the epicenter of the outbreak in New York. I think it's fair to say New York was hit harder than anybody in the beginning of this. And tell us how that was for you.
So, right, we're were really close to New Rochelle, New York, which was, the epicenter. But, it's so close to us, and we're part of a consortia. The way people use libraries in my county is there's a lot of movement around it. So if it was happening in New Rochelle, I was just pretty sure that it was going to be happening here in White Plains. I was also in contact with some of the librarians on the West Coast who were equally hard hit, and they were beginning to, talk about closing. I think that for every public librarian, I think we all experienced something really similar. The idea of closing was just anathema. It was just something that we couldn't, it took me a day to really sort of get my head around the fact that we were going to close the building, because in response to all the other catastrophes we've had, like hurricanes, we've always extended, what we can do and our physical place. But by the 13th, we decided to close, and I had a very supportive board, which was great. And we shut down the building. One of the things that my colleagues were really clear about, we were all really clear about, was that the building may be closed, but the library is open. And I think that libraries are in a rather unique place, vis-a-vis other organizations, because we had a good, solid infrastructure to build on in terms of being able to provide chat reference, obviously telephone reference, but, we had a robust digital collection. So it wasn't like we were, really shutting down this library. We were just kind of like shifting our focus, our energies, and our budget towards digital services. It was really remarkable in a way. There's so many things that public libraries do today, but what it really ended up doing in March and April was really centering us on providing information. I mean, that's kind of like our basic, one of our basic practices. And we really needed to go back to that. People were hungry and desperate for reliable information, whether, we were able to bring people to the CDC information, New York State information, et cetera, et cetera. And that was a really, really powerful thing, and you talk about information, and of course, the conflict was we, in addition, had a federal government that was, actively sending out misinformation. So, you would actually get reference calls with people wanting to talk about whether they should gargle with bleach. It was that serious, what was going on. Sort of to talk a little bit about our overview, the building stayed closed until June. And then by that point, we figured out how we thought we could do a good, safe grab and go or curbside pickup, whichever you prefer, program. And we implemented that in June. And I think that for everybody that's involved in this, one of the takeaways from this year has been how immensely popular that program is. By July, actually, we began to open the building in a pretty controlled fashion. At that point, the number of new cases on a 14-day basis in Westchester was around 30. So, with 30 new cases and a population of 800,000 a day, it seemed like we had good numbers. And that managed to continue all summer until the fall, when the numbers started to not just rise, but they just almost seemed to escalate. And they were 400, 500, 800 new cases a day. And at that point, we shut down physical access to the building and just kept with curbside check-in, and that's where we are today. So obviously we continue to monitor our numbers, and I work with all of my local libraries so that we're sort of in sync on this. We're now looking at around 350 new cases a day. I'd love to see that get down to 50, and then, we can start looking at reopening the building again.
Great. Thank you, Brian. Annie, give us a sense of how Delaware has coped with this unprecedented crisis.
Sure. Thank you, Andrew. And greetings from the home state of President and Dr. Biden. We are really proud of Delaware libraries and their pandemic pivots. It was a little chaotic at the beginning, but the library directors all met weekly for the past year. And so it's straightened itself out pretty quickly. And they've been sharing tips and challenges all along. The library staff all participated in professional development to get ideas as well, the national webinars. And that increased about 300% over the previous year. So we've gleaned a lot of ideas from all of you as well. So just a quick list of some of the things that they've done. Library parking lot wireless at every library, library card registration moved online. We expanded ebooks, we had Overdrive, we added Hoopla. I was most impressed with what they did with the virtual programs. The library staff experimented with various online tools, Zoom, Facebook Live, and we also had a statewide virtual calendar. Curbside checkout, of course, also book bundles, printing to go, and one library has been doing 3D printing to go. So we finally got Chromebooks and MiFis because, of course, everyone on the planet was ordering Chromebooks, but ours finally arrived, and we're planning to start that pilot in the next week for Chromebooks and MiFis. The reference librarians, of course, plus the social workers and the employment specialists, they all moved online. We reestablished a phone line for those without internet access, and so they could make appointments and such. And then many of the library parking lots were used for food distribution, COVID testing, and much more. A couple things that I think might be unique to Delaware that we did. We hired a building consultant who provided recommendations for each library for their outdoor library spaces to move the library services outside. And we're also getting ready to pilot telehealth kiosks or telehealth booths in 3 of the libraries. One of the key things that we did was we implemented Dolly Parton's Imagination Library for preschoolers statewide. That was a perfect service during the pandemic because, of course, it's books by mail until those brutal mail delays. But, there's always something. But we have received more attention for Imagination Library than anything we've ever done. So I highly recommend it. The governor, the first lady, the secretary of state, they are all loving that program. So I really recommend that highly.
Well, terrific. And, I've said it before and I'll say it again. Dolly Parton is a national treasure. Patty, give us a sense of how you've coped. Brian mentioned it, and it's true. Southern California has also been hit fairly hard by this. How have you managed?
Thank you, Andrew, and welcome everyone. Sorry about the technical delays earlier. The Southern California has been hit pretty hard. We can't, the numbers are in the thousands in terms of activity and deaths, unfortunately, in terms of COVID-19. But I think just like all of you, libraries are emerging as one of the key leaders in the community to try to maintain a sense of normality, whatever that means, and also provide services when and where we can. So we like to say that the buildings are closed, but we remain open. I think Brian mentioned that earlier. It means that we're looking at our services in a much more different, in a different way in terms of delivery, really responding to the needs of our community of where they are. So the printing on demand is very important to us, but printing on demand and also offering our tax duplication as a service. One of the things that our community is very interested in doing is is cooking and gardening and doing a lot of things. So we have a seed library. We decided to actually establish seedlings to give away. We have take and make kits just like everyone else. Our dial a story and all of our services are now done not just only in English, but also in Spanish and in some cases Amharic, which is another language that is frequently spoken in our communities. Some of our libraries, San Diego County, San Diego Public, for instance, have had some minor openings and still have remained open. They have not had to close, but there's limited service. And it's a combination, it's a hybrid. And I think that's probably what most of us will be undergoing in as we move through the process. The other thing that we're doing is trying to maintain that social connection with our community. And so a lot of times people are calling or they're emailing or they're speaking to us at curbside just to maintain that social connection. And we're trying to maintain a semblance of order at the same time trying to be safe. It's offered us a lot of different kinds of opportunities. And I'll talk a little bit about it later, but we have been able to advocate for our team moving forward in terms of thinking about the vaccination delivery in a different way.
Great. So, I know we know a lot more about the virus today than we did when the outbreak first happened, but information has been pretty hard to come by. There's a lot to be concerned about with the arrival of new variants. There's a lot to be, looking forward to with vaccines starting to get into arms. So this week I caught up with Professor Jeffrey Shaman. Now, if that name sounds familiar, it probably should, because he's been quoted pretty much every week of the pandemic. Besides Dr. Fauci, he's one of the most prolific researchers when it comes to trying to understand this novel coronavirus. He is the director of the Climate and Health Program at the Mailman School of Public Health at Columbia University, where before the pandemic, he was studying how respiratory infections move around. So in the clip I'm going to show you, I talk with Professor Shaman about the variants and the vaccines, and I ask him a few directly library-related questions. So I want to play that clip now. It runs about 17 minutes, and the panel will come back and we'll talk about it on the other side. Rob, why don't you go ahead and run that? So let's talk a little bit about where we are now, almost a year later. Let's start with variants. Talk to us about variants. My understanding is that variants are common for viruses, but how concerned should we be about the headlines that we're seeing about all these emerging new variants?
So variants of concern are unfortunately of a concern. We're not out of the woods with this yet. And it's because, again, it's a novel agent. We don't know what kind of pattern it's going to settle into. For the endemic coronaviruses, and there are 4 of these that infect humans and have for quite some time, that cause very mild illness. They have funny alphanumeric names like OC43 and HKU1. But these viruses have many, many variants, and they appear to be able to reinfect people over and over and over again throughout the course of their lifespan. The concern is that this new coronavirus will do the same thing. And if it does, then the question is, will the subsequent infections after your first infection or after receiving a vaccine, will they be milder? In other words, will this settle into a pattern where people are repeatedly infected by new variants that have arisen because of this virus, but will they tend to be milder infections so that we can get back to normal and it's not the level of threat that it is right now because it has such a high infection fatality rate? And unfortunately, that's an open question, one that we really don't know the answer to as of yet. These variants that we've been hearing about, things like the UK variant, the South African, the Brazilian, a couple new ones identified in New York State recently and California as well, these are of concern. We have to monitor them. We have to see how successfully they evade pre-existing immunity for those who are naturally infected or evade the vaccines that we're currently taking that were designed for other variants, on how they evade certain treatments like monoclonal antibodies. What we've seen is that in some cases, like the South African variant versus the AstraZeneca vaccine, which is not available in the US but is used in other countries, it renders that vaccine almost completely ineffective, it appears. Similarly, there's a treatment of a monoclonal antibody by Lilly that's rendered ineffective because of it. So what we really want to know is, and we're going to have to monitor, is how effectively and rapidly these variants evade the immunity that we already have. How often are people going to be reinfected? And what is the likelihood that a person upon reinfection will wind up in the hospital?
Let's talk about vaccines. My reading is that history shows us that vaccines can crush epidemics. Is that going to be the case here? And we hear about these different vaccines with different efficacy rates and people not wanting to take AstraZeneca because they want the Pfizer vaccine with a higher rate. But is it fair to say that we're in a race against a virus that is changing and that people should just get the shot that they can get?
Yeah, I think that's fair to say. I mean, look, the Johnson & Johnson vaccine is coming out. It was just authorized in the United States, and they're shipping the first doses now, I think, as we speak. And you'll hear that, oh, it's 70% efficacy against symptomatic illness, but it's actually more effective against severe illness as well. So it's moving more towards the numbers that we see for the Pfizer and Moderna vaccines, but you should take it. If offered it, just take it. Don't worry about that. Get the vaccine in your arm, get some protection. The reality is there may be issues with some of these vaccines. It could be the Pfizer, it could be the Moderna, it could be the Johnson & Johnson, the same way we saw with AstraZeneca against the South African variant. We're just not going to know. So it's impossible to know what will emerge. Now, the question you ask is, do you get the vaccine and then are you done with it? Is the real question we'd all would love to know, and we'd love the answer to be, it's like the measles. You get a measles vaccine, maybe get a booster, and you're set for life. You're not going to have to ever have the measles. The threat is completely quashed for the course of your lifetime, like chickenpox vaccine as well. But unfortunately, this one seems to be more like the flu, where we have a vaccine that is partially effective and that new variants arise all the time that manage to partially evade the immunity conferred by the vaccines that we develop. And if that's the case, we're going to be in this continued arms race where we're going to be wanting to produce new vaccines and new treatments that are targeted to the new variants that are out there. And we're going to try to stay a step ahead of it and provide those to people to give them boosts. But the real thing that's going to be critical is whether or not upon reinfection or upon infection after seeing a vaccine, even if it's a variant that escapes and causes more symptomatic illness, are you still not going to wind up in the hospital? If we find that people are much less likely upon reinfection to wind up in the hospital, we're going to move into a zone where it's going to be more like the seasonal flu. If we're really lucky, it might be more like the endemic coronaviruses, which are even milder and don't put people in the hospital at very big rates. But if we're not so lucky, maybe it'll be like seasonal flu. And if we're really unlucky, it's not going to change in terms of the rates of hospitalization upon reinfection. Those, unfortunately, are the open questions that we're going to only see over the course of time.
So our audience today is the library community, public librarians and administrators. So I wanted to get your take on a few things. One of the common complaints I hear from library directors is about the lack of actual concrete guidance. They can see the research and the facts and the science, but they still don't know what to do. But they've been doing their best. And so I wanted to run a few things by you and see if I could get your take. We'll do this in sort of a lightning round fashion, but
okay.
Reopening public libraries. Good idea, bad idea? Where do you stand on opening a public library?
I think it's premature. I would prefer to see case rates on a daily basis at much lower levels. I mean, right now we're having 50, 60,000 a day on average right now. I would love to see it under 1,000. I'd like to see it like 500 cases in the entire United States on a given day and a much higher rate of vaccination. And then we begin to start opening up with masking and do things in a cautious fashion and make sure that we don't see surges in the communities in association with the reopening of libraries and other businesses.
Got it. Libraries are taking great care to quarantine materials that circulate. They wipe down computer stations in the library. They quarantine books for a few days before they recirculate them. Is that, where do you stand on that? Is transmission via a book or a computer station something we should be concerned about? Is it high risk, low risk, moderate risk?
It's hard to say. I mean, there's sort of the CDC guidance now that thinks that surfaces, or what's sort of called fomites in the infectious disease epidemiology, are a lower risk and is not the dominant mode of transmission, that it's more droplet and or aerosol, some combination therein. I think the reality is that you want to continue those practices. It doesn't hurt to do it. It is a bit of an inconvenience right now. And if it lowers the opportunities for transmission of the virus, which it will, Even if it's only a small increase associated with having surfaces that are not cleaned, you might as well clean the surfaces and store the books for a while to allow any viral particles that remain to decay.
Library buildings are old. Many of them are very old. How much of a priority should modern new air ventilation systems be? And is there a baseline for effectively filtering out airborne disease through these systems?
Yeah, and I can't remember the terms for it, but there are certain filtration systems that I forget what it's called, something with an M. And level 13, I think, is the level you're supposed to go to, which is a level of efficacy that they have been recommending for the degree of filtration. But this idea of the indoor environment and retrofitting buildings that we heard so much about, particularly in the spring and early summer last year, as a means of trying to deal with this virus, really poses a larger question, which is how do we manage the indoor environment to keep people healthy? And we don't do a very good job of that. The only thing we do is we try to manage temperature somewhat. We heat in the winter and we cool in the summer a bit, usually more of the former than the latter necessarily. But we don't manage humidity levels. We don't filter the air. We don't manage particulate matter, buildup of carbon dioxide. As a matter of fact, the indoor environment is an area that's very little studied, and considering that we spend 90% of our time in it, it might be beneficial for us to consider what are the optimal conditions that would promote human health under different circumstances, and how do we set up systems going forward that are going to help with that? And that includes the issue of ventilation, and ventilation in response to a respiratory viral pandemic such as this.
Now we see things like spit guards and barriers, and these things I think make us feel a little bit safer. Are they effective? Should we get used to seeing frontline workers sort of like bank tellers behind some sort of barrier?
That's a great question. Humans are social creatures, and we can't just try to thwart all the germs, continually. We would like to be able to come together. We would like to have interaction. I don't think most of us want to live in a world of glass and plastic shields and whatnot. However, they are effective at cutting down the transmission of diseases. Right now, we are particularly sensitive to that. The need for it is kind of acute. And I think that over time, we will probably lapse once we move into a post-pandemic phase and hopefully settle into some sort of equilibrium with this virus where it's not the threat that it is right now, that we'll be able to drop some of those things and have more of human interaction, because I do think people crave it and we need it. And it's very important, even with people who are not your immediate friends and family, the ability to interact without having some sort of barrier between people is not the ideal way of going forward.
I have to ask about masks. I mean, I don't know how it ever became a political position to wear a mask or not wear a mask. It seems like an easy thing to do. People are getting sick of them, I know, but we should be wearing masks, yes?
Absolutely. Yeah, I mean, there's nothing to say other than you should wear masks. I mean, we can certainly talk about the issues of how it was made an issue of identity politics and a wedge issue, but I think we're all aware of who did that. So wear masks.
Right on. Children. Children's services are a big part of what libraries do, but we don't really seem to understand the role that kids play with COVID-19, or how the role they play in transmission, whether they get infected or how they get infected. How should librarians approach reopening their kids' rooms?
Well, there's a lot of conflicting information in the scientific literature about this still. There's evidence that's been more tilting towards the fact that children aren't as involved in the transmission. Early evidence seemed to suggest things such as, they weren't involved, they were involved, they're just as capable of catching the virus. They're only a third as capable of catching the virus, but they have 3 times as many contacts. Therefore, it all comes out in the wash. It's hard to say. What is clear is that children do not suffer the disease, COVID-19 disease, at the same rates that adults and the elderly and those with chronic conditions. So in other words, this infection is really able to really infect lots and lots of people, including children. It seems to really hit adults, but and by adults, I mean like 20 to 50 years old. But it's a disease of the elderly. The older you get, the likelihood that you'll wind up in the hospital because of a SARS-CoV-2 infection increases quite dramatically. And, elderly people who have chronic conditions, somebody who's 85, 75 years older, they're 1,000 times more likely to wind up in the hospital than somebody who's 8 years old who gets this. But we do know children can get it. We know they're capable of passing it on. So the risk is non-zero. There is some risk associated with it. And we have to remember that children are always the most hygienic, particularly young kids. And so, having policies in place that try to keep them masked, limit their interactions with each other, keep them distanced, is going to be beneficial for people until we have enough of everyone vaccinated that we feel, and the viral infection rates, the case rates are dropped down, that we have a sense that not only do we have a lot of people protected, but the amount of virus that's circulating in our communities is very low at this point.
Okay, last question. We appreciate your time today, but I'm just hearing a lot of optimism in the press, right? We're seeing the numbers sort of go down.
Mm-hmm.
And this may be the most 2020 thing I've said so far in 2021, but that is, optimism scares me a little bit, because we've seen how, normally with a pandemic, you'd see like a bell curve, right? It'd go up and then it would come down. But with this virus, we're seeing curves. It's going up to a new plateau and it's going up to another plateau. I'm worried that we're going to find ourselves hitting another plateau and going up again. Do you see, where do you fall on this? How optimistic are you? Could we see another third spike here? And what would you suggest?
Well, we certainly could. We don't know what's going to happen. And I think we have to keep that in mind, that this is a novel respiratory agent. We do not know specifically what it will do. However, I will say that the pattern it has followed is very consistent with what we observed in 2009 and 1968 and 1918 with other pandemics. Those were influenza pandemics, but influenza is also a respiratory virus. They had a spring wave, they had a fall wave, they had a winter wave, and then they had another wave the following winter. So if we were on track to follow that, we're not going to have another big wave of this maybe until next winter. But those happened, particularly like 1918 and 1968, in the absence of an effective vaccine against it. So now we have a vaccine, and that's going to hopefully disrupt it. I am cautiously optimistic. I do not think the numbers of cases that we're seeing, the way they plummeted during the month of February, will continue as precipitously, however. We've already seen a plateauing at around 50, 60, 70,000 cases a day over the last 2 weeks. So the question is, will we slow down in our drop? We need to remember that 50,000 cases a day is a lot. That's more than it ever was in the spring wave. It's near the peak of what we saw in the summer wave. That is a lot of people who are coming down with this, and it's a lot of people who are potentially going to die from the infection. So it's really critical that we look at this with kind of a clear-eyed fashion, that right now, as the vaccine is being rolled out, we need to maintain our non-pharmaceutical interventions. We need to continue with the mask usage, the social distancing, the limiting of gatherings, all those other policies that we have in place that are trying to prevent or limit the opportunities for person-to-person transmission. Because right now we're in a race, and the race is to get the vaccine in as many people's arms as possible before those individuals are infected with the virus. Maybe 55, 60% of our country has yet to be infected by this virus. And we would like to get the vaccine in as many of those people's arms as possible. However, if we let our guard down, the virus will accelerate and more people will be infected before they get the vaccine. If we were to ramp up our control, then even fewer people would be infected and get the vaccine before ever encountering the virus. Again, I'm going to use this example of Vietnam. Vietnam has had 2,500 cases to date in a country of 97 million people. If they get the vaccine and are able to limit the numbers over the next year to another 5,000 people as confirmed cases, right? And they get the vaccine into 80, 90% of their population's arms, then the vast majority of the people of Vietnam will have been vaccinated before they ever encountered the virus. That would be a real success story if that were to hold. The United States is way behind that because 40% of our population has already had the virus, so we think, right? And if we let our guard down now, though, more people, it's going to be 50% before they're vaccinated or 60%. The idea is to hold on to those non-pharmaceutical interventions and even increase them for the time being while we're spilling out and distributing and administering these vaccines so that we can get people protected so that if they do get infected, the results will be milder. They're not going to wind up in hospital, and they're not going to wind up dying from it, or less likely to, at least.
We've been talking with Professor Jeffrey Shaman, the director of the Climate and Health Program at the Mailman School of Public Health at Columbia University. Jeff, thanks for your time today. I really appreciate it.
My pleasure, Andrew. Be well.
Okay, so a lot to digest there. Some real talk from a leading epidemiologist. I'd like to get the panel's reaction to some of this. You know, one of the things he said, obviously, was from an epidemiologist's standpoint, he would like to see libraries not open and other businesses not open. We know there's zero chance politically of that happening. So that said, to this, and Brian, I'll start with you.
Well, Andrew, first of all, I'd like to say thank you, because that's the interview I've been, wanting to hear for the last year. It's kind of astonishing. I mean, I have to say what he's saying in terms of, I think it was 500 cases nationally before we consider reopening. And I think that is something that I think it would be a hard sell. I'd be looking more, I think, closely at what would be happening locally, in terms of my state and then in terms of my county. It was interesting, too, what he was talking about in terms of vaccines. I mean, I think when all said and done, the lack of leadership that we have in our profession around the subject of vaccines, whether it's individuals or organizations, we just have not seen library workers advocated for in any meaningful way to move us up in terms of vaccines. And, I don't see that vaccines are a complete solution in terms of opening. It's not like all of staff will be, vaccinated and we can, throw the doors wide open. That's not what I'm saying at all. But it's another factor amongst many. And the lack of that and our failure in that is, I think, really significant, and I think is going to be a problem in the months ahead.
Andy, I was going to go to you next and ask your reaction. Anything you wanted to bring out?
So, well, I think that Dr. Shaman has just upstaged all of us with that comment about not ready to open. That'll be the viral tweet. So I am really proud and happy to be in a state where the governor cares about safety, as well as the president, of course. And I'm really glad that all of the county executives, the governances for libraries were very supportive of safety and any of the staff concerns. The one county that others, they are getting pressure, and so one county is opening, and it was big news on WBOC this morning. I saw it about 100 times. It's breaking news that the libraries are opening, which is great to get that kind of coverage. But, it's really important. And we have frankly, we've gotten nowhere with trying to get on the vaccination priority list. So, we've all tried to reach out, because in Delaware, it's only half a degree of separation. So we figure we all must know somebody trying to get on the vaccination list. We have not been successful so far, but we even, when the patrons, and of course, we've said this throughout the past year, we want libraries to open. Well, of course, the first question is, well, what is it that you need so that we can try to meet that specific need in other ways, such as curbside or whatever. But now, as the vaccines are out, we say to the patrons as well, well, you want libraries to open, help us to get on the priority list. So it'll be interesting to see. I also think it's a little premature until we get the vaccinations. But I know that, as I said, the governances are all being very cautious and managing the safety very carefully.
So I think it is. You would expect an epidemiologist to want to crush a disease before returning. What he said makes a lot of sense to me. He'd want to get it down to 500 cases. But we see Texas is now 100% opening and getting rid of masks. New York is reopening. there are political realities. People do need their libraries. They are going to try to get back to some semblance of normal life. I know you've been wrestling with that. Joslyn, do you want to give us a sense of your reaction to this?
I'm like bursting out of my mute, wanting to say something. I just, first of all, let's not make that the viral tweet at all, because that doesn't do anybody any favors in terms of what you have to do individually at your location. I think we touched upon that. And one thing I do agree with that he said is what he said about not being a zero-sum game. I think you can, if you're open, that doesn't mean you're just like, whatever, blah, you know, like, let it all hang out, let's do anything. It doesn't have to mean that, that you're open, that's how you approach it. You can be open safely. We have learned things in this year plus that we've been in this. So we do know, we do have tools now, we do know what we can do to make things as safe as possible. You know, and if your library can provide the PPE, if you can space, if you can utilize work from home things, if you can be creative with the scheduling, if you can limit hours, I think, you know, it doesn't have to be one or the other, and that's it. And it just kind of depends on where you are. And it really doesn't. In some counties, some communities can have that luxury of saying, you know what, we're closed until everything is cured, until all diseases are cured, we're never going to open again. And some places, and you touch upon that too, politically, that's just not going to be your answer. And then we're all going to be home forever with no paychecks, and we're going to be closed, because it is about show and prove. When the county or the city is looking at depending on where you are, you know, the reality could be, you know, who the budgets, everybody's county and city budgets have taken a hit. And so when they have to look at who is getting impacted, who's at the table, you know? So to me, for my experience, I'll just speak to my experience, because I think that's important too, because this thing has taught me also that you can't, what's worked for me doesn't work for, you know, our young ladies on the panelists, our kind sir on the panel. It doesn't work for their communities in Delaware or in Westchester County, or where I am in Newark necessarily. And so just to not have that judgment also either way, that's another thing that's taught. So my reality, you know, I might not have the luxury of where my county says, yes, go ahead and close. We got you. You're fully funded. We appreciate you. It might be like a survival of the fittest kind of thing. And if you have that, if you are in that reality where it's a survival of the fittest, a better approach is showing how you can be part of the solution of helping the pandemic, whether it's getting information out. And I'm not saying everything has to be in person. We did a really good job going virtual too, and pivoted really quickly and all that too. But, you know, can you be of service in a different way? We have customer service skills. Can you answer a phone? Can you be the source of good information and just make that clear? It really just comes down to being relevant. And I think you can be safe and be open. It's not one or the other. So that was my take.
You raise a very good point, an excellent point. In fact, Professor Shaman in the interview he talks about Vietnam, which has been open, and they've kept their cases down to 2,500, and they've done it through non-pharmaceutical interventions, wearing masks, socially distancing, being smart, and their economy has stayed open. So a very, very good point there. We are in control of our destiny and our fate. Yeah. Patty, your take.
Thank you, Andrew. I think I agree with everyone that, but it is on some levels, even though I think we might be looking to National Library leadership to say something. I will tell you that part of the reason why that didn't happen is because of how effective or ineffective that messaging might be. It is a local issue when you do talk about vaccination triage and reopening. Those are all locally based plans. And I think there's a lot we can do, though, to advocate for ourselves locally. I'll give you an example. Even just recently, Sky Patrick, who is the director at the LA County Public Library System, she advocated directly on behalf of librarians in the county. She has a direct connection to the county public health director. And the health director agreed that youth services librarians who were in direct support of children who are coming back to school could be seen in that tier 1, 1B set along with educators. But that's not, I think, a determination that could have been made statewide at any time. So now the rest of us are benefiting from that advocacy that's happened at that local level. I do think it's going to take a number of local actions, actually, not only to create the strongest process possible in terms of reopening, but also that exchange of information that we can share across the board within chapters. I know Illinois has done some great advocacy. I know that Annie and her team are set up to receive that information so they can advocate on a statewide level. But I do think that in California, unfortunately, especially in LA County, we have probably among the worst numbers possible. And as a result of that, we are making the decision that we will probably not reopen fully, 50% perhaps, but only after the vaccinations get implemented. We just have to make some hard decisions, and a lot of that has been based on the rate among staff and the rate within the county as a whole.
Let's talk a little bit about what you need, what libraries need, what libraries want. Like, I think there's an advocacy opportunity here, right? There's something that we can go to local leaders and say, this is what we need. You want us open, give us this. So, Joslyn, let's start with you. Talk to me a little bit about your needs list. What would you like to have?
Well, I think this pandemic has really put a spotlight on the condition of buildings. I know the doctor touched upon that as well, just like schools, where a lot of us are in aging buildings. And so even as I spoke about how we could be a pal, so to speak, and be helpful, like in some cases, even if we have the space, it's not ready. It's not ready to go because it's just, everything is so outdated and in need of tender loving care and service. So what do I need? We need modern buildings. We need to be part of the conversation when like the city or state gets reimbursement for PPE and we're scrambling trying to figure out how to pay for it, and taking from here and taking from there. And just to not be forgotten in the conversation. In New Jersey, I was happy that we did have a state mandate specifically for libraries back in the summer about how you could reopen safely, and list some guidelines of what that would look like the percentage and all that stuff. But I know every state doesn't have that. So then, you're caught trying to shoehorn yourself into, well, I think they're talking, well, we're kind of this kind of business. So just to be, we need to be a part of the conversation. That is an ongoing thing with libraries, and even in the best of times when we are not in the midst of a pandemic. But this just really put the spotlight on the support, the advocacy, the amplification we need. That because we provide such needed services in the community, it's not for free. It's not out of magic. We need support, and we need to be recognized. And what they said too about the shots, the same thing. So, in one voice, we're saying we're calling ourselves frontline workers, but we're not even thought of in the categories necessarily. I wait with bated breath every time they announce a new one. Are they going to say library? And they never do say us. So that's what I would say we need.
Annie, I'll go to you next. You mentioned, broadband services, et cetera, the digital resources. What do libraries, what's on your list for Delaware libraries? Mute button.
Thank you. What they always need is advocacy, and they need money. And so while all my staff and the Delaware libraries have been doing all this work and making all these pandemic pivots, what I've been focused on, I'm kind of looking at the big picture and the patterns that I see. And a crisis highlights underlying issues, which kind of make me really nervous when it comes to advocacy and money. And first of all, non-humble brag, the governor did put $600,000 in his recommended budget increase to state aid, plus $500,000 for Imagination Library. So, everyone's doing great things, but it just, it's how do we seal our future so we never have to be concerned again? But what I saw this crisis highlight was that we still have a major focus on books, and whether that's locally and nationally as well, between the quarantines and dealing with 17,000 books stuck in transit, but also the realm study at the national level. But meanwhile, we also had this partner panic because they couldn't get into the library buildings to help people. We've been really focused on developing partnerships, and it was kind of like we defaulted to our core, which is books. The library profession has an integration challenge and how to integrate these new services, such as partnerships, into our core, our professional paradigm. It reminds me of the classic Rule of 1965 by Karen Hyman. The Rule of 1965 states that anything the library did prior to 1965 is basic, and anything else is extra. I'm looking at collective impact as the solution, and that's an ALA Future of Libraries trend. And I think that would help with this partner integration. So anyway, in the midst of all this panic in September, we signed on to this National Communities of Excellence, which is an initiative. It's a collective impact effort around the Baldrige framework, which is another webinar. But it's a 3-year program, and we're in the 4th cohort of this, and we are the first libraries to be involved, and that's even for literacy. And then we had also signed on to Unite Delaware. Unite Us is a software. It's a software company. They have a referral platform for direct interaction between organizations. So if libraries are trying to help someone with basic needs, they can, with their permission, enter them into this database, and then it goes directly instead of just handing them a phone number on a piece of paper. There are more than 40 states involved, and I asked if other about libraries. They said, well, I think there were 2 military libraries involved. So Kleinenberg said that, of course, libraries are part of the key social infrastructure, but I think we need to evolve from a scattershot to a more strategic and systematic approach. Libraries should be leading community collective impact efforts. And then we might finally conquer that outcome measurement, which IMLS has challenged us to resolve since the turn of the century. So that's where my mind is going, is trying to figure out how to get libraries money, how to position them so it's never a concern again. That's all.
Great. So I'm going to move on because this is a question I want the entire panel to address as we're coming up on our time here. And that's, how have libraries changed through this experience, right? We talk a lot about the new normal and what the new normal is going to look like. And we know that this pandemic has it's exposed so many things about society. This pandemic has not hit everybody equally, right? It's changed the profession in terms of, how staff view their work, etc. So for each of you, and I'll start with you, Brian, what does this mean for, how's the library going to look in 2021 and beyond? What have we learned from this, and what do we expect to go forward?
Andrew, I wish I knew. But it's sort of something that I think about every day, as I'm sure all of my colleagues here do think about it. What is the library going to look like in 2021? I see a gradual reopening and a reintroduction of services. I would like to see us continue to lead and begin to really lead in our communities on the issue of universal broadband. I mean, if there was anything that we should have learned in the last 12 months, it's how necessary that is. I want us to acquire more hardware that we can circulate to our communities with greater ease. That was another thing that was really, really sort of something that we really learned this last year. We have been really successful. I don't want to say that there have been good aspects to a pandemic, but I think that we've learned an awful lot. And two of them is, well, the first one is that we've had real success in collaborations in ways that we haven't been able to ever achieve before. And one example for that is with our school district, where we partnered with them to have a one book, one read, and we were using the Kenney Reynolds book stamped. And we ended up, going through Zoom and librarian classroom teacher partnerships. We ended up having 40 book discussion groups going on. That's the sort of thing that we could never have pulled off in any other time. So I think that the door has opened in terms of relationships that we've, that we've wanted to sort of enact on in the past, but haven't really been able to.
Great. Patty, you want to weigh in on that? How do you think the library might be changing?
Thank you, Andrew. I agree totally with Brian. I do think that a key underpinning of the service we have to provide is based on equity. Equity in terms of service, in terms of access. ALA actually passed a resolution that indicated that broadband should be a human right. Like electricity and water, it could be even considered a utility. And I think we need to move forward in that process. I do think it's going to be incumbent upon us to really be able to serve the most vulnerable of our populations, as well as to provide access to all. And so I do think that there are opportunities for us to garner political pressure. The Build America's Libraries Act, actually, that is just coming through right now through the House and has been introduced at the Senate level, offers us an opportunity to be able to leverage some political will to build our libraries back up again and to do some of that integration that Joslyn was talking about and Dr. Shaman was talking about a little earlier. I do think that there's an opportunity to build on partnerships, as Brian indicated, but it might also be maybe not our better known institutions like schools, certainly, but maybe some public-private partnerships need to come our way, and to think about diversifying our income sources. I think we need to be resilient as we move forward. And if anything, 2021 has put a little bit of light in our direction, and we need to continue to advocate for that.
Great. I'll go Annie and then to you, Joslyn, how the library might change.
How the library might change. Well, I saw Bill Gates, he's been interviewed for his new book, and he was talking about the thing that he's watching is how communities, the workplace is going to change because more and more people are going to continue to work from home. So I'm thinking that's going to be a real issue as far as locating libraries. How is coming back, how is it going to impact the library's locations, and are they still going to see the same traffic? How is the traffic going to change going forward? I think we'll keep a lot of the new innovations that they develop, like I think the programming will be hybrid. The book bundles are super popular, but again, the libraries need to change in terms of collective impact. We all need to be working with everyone in the community to improve those community indicators, and that's going to help integrate us and enable us to succeed once and for all.
Joslyn.
I think what a huge change is going to be is how we live and operate in library spaces. I think this experience is going to really inform a different way we look at how library services look in terms of our spaces. Do we need, a giant library? How do we set up the chairs? Or do we need like a smaller scale something where it's more of an express service? So I think it really is going to impact that piece of our profession. And also it is possible to pull something positive out of this and a silver lining. was, I love the quote, I don't know who said it, it's like, move fast and break things. So we learned that we could do that. We learned when things were broken, we could move fast and pivot and get some jamming programs online and get, change our service really quickly versus, the way we used to did, what is that, BC, before COVID, where we would, oh, we have to do some research. I don't know. Let's talk about it for 6 months. We didn't have time to do that. We had to rock and roll and go. And then it's just a good reminder for us, though. That's what we always do as librarians. That is what we've done since they said, oh, you can't have videos because you make Blockbuster go out of business. You can't be like a bookstore. You can't, I guess since the papyrus, they probably said something about what we couldn't do because that would be, oh, no, you can't do that. And we're still here. We're still here and rocking it. And so this was kind of a reminder what we had in us to be able to do it. So that's what I would say.
Thank you. You think I'd learn how to use the mute button at this point in my career doing Zooms? And
we all still don't know.
Wait, I'm not the only one.
Well, I want to thank you all for taking the time to join us today. This is obviously a wide-ranging discussion. We've only touched upon a few of the things that are going on in the library world and the challenges y'all are going to face in 2021 and beyond. I want to thank you for your good work. I want to thank our audience for joining us today and our sponsor, Library Ideas. I want to remind you that you can see the full interview with Dr. Jeffrey Shaman on the PW site. It'll be up pretty soon, later today. And I want you all to remember to stay safe and be well and take care of yourselves. Wear your mask, respect your fellow citizen. And we'll see you again shortly here at the Library Lounge. Thank you all again.
Thank you.
Thank you.
Thanks, Andrew.
Be safe.